A large group of nurses rallied outside Christchurch's Hospital today to protest a lack of investment in healthcare. A proposed pay deal was rejected last month by 27,000 nurses and midwives employed by district health boards. And the nurses' organisation is now organising rallies all over the country. But not everyone in the union is happy with how it's handling the ongoing negotiations. Here's Logan Church.
That's the sound of 100 nurses who have come out on their lunch breaks or day off to protest pay and lack of resources. Among them is Karen Marshall, a clinical nurse specialist who works in the spine unit at Bearwood Hospital. She says the strain of an underfunded health system is felt keenly by Christchurch's nurses.
Nurses are tired, they're fatigued. Some of them are going home crying. I see nurses, because I work across sites, that have had enough. They don't want to continue nursing because of the way they're feeling. And it's very evident on social media that some of them are feeling that way.
The New Zealand Nurses Organisation has been embroiled in a bitter pay dispute with the country's district health boards. After pay talks fell over last month, rallies like this one are being held all over New Zealand. Karen Marshall says the nursing profession, which is the backbone of most hospitals, is losing its most experienced staff.
And those are the ones that we need to keep in the nursing profession because they love teaching. They're our resource for teaching our new nurses, and it's attracting those from high school into the nursing profession as well. And if we aren't well remunerated for that, we're going to lose that skill. So health does need nursing, and we need to be recognised and valued for the skills and the care that we provide.
Cheryl Hannam from the Nurses Organisation says these problems result in an unsafe environment for staff.
It's about safe staffing, it's about numbers, it's about making sure that we have good staff to patient ratios, it's about being able to cover sickness and injuries and things like that to people, especially our nursing colleagues. Over the last wee while, certainly in the mental health system, there's been a lot of media about injuries to staff over there, and it is just about making sure that everyone has the right to go to work and be safe, and this is what it's about, safe staffing, the right to go to work, not be in fear.
In a bid to try and move negotiations along, a panel is being established that will have a representative from the Nurses Organisation, the Health Board and an independent chairperson. However, this has faced some backlash from nurses within the union, with some taking to Facebook with their concerns about a lack of consultation.
No idea who they spoke to, as the general feeling that I have observed was a resounding no to the panel option.
I'm really pissed. This is going to take at least another 6 weeks with no guarantee of a suitable outcome. So sick of delay tactics.
The independent panel will not prevent us moving forward with what we are already doing. It is an aside to our actual negotiations.
The Nurses Organisation rejects this. Its Industrial Services Manager, C. Payne, doesn't think the panel will delay any potential settlement.
The panel's work is going to be pretty timely and pretty quick. That's another principle that we had, and our view is that we'll be constituted and be at a point to make a final recommendation within 3 to 4 weeks.
The union is planning to meet next week about proposed industrial action. The Canterbury District Health Board had no comment on today's protest. In Christchurch for Checkpoint, Logan Church.